Oh, hi. My name is Monica. I am a midwife and I work as a senior project manager in the Integrated Care Board. I work with the local maternity and neonatal system, and my role involves implementation and development of the perinatal pelvic health service, which is a pilot that we started 3 years ago. So I'm here today to talk to you about working with different communities and engagement with different people across communities. And to be honest, when I started in this role, I knew very little about engagement. Despite working in senior and operational roles within maternity services, in terms of engagement with other communities, there is very little that you do as a clinical midwife. Obviously, I had engagement with patients and maternity voices partnership, but we really did have very little engagement with people in our local communities in my previous role. So I knew very little about engagement with different communities. So when I started on this project, for me, it was very important to be able to hear the voices of women and birthing people from different communities, partly because we live in a very multicultural area. Southeast London has a population which is very diverse. So for me, it was very important to listen to all women and birthing people from different backgrounds. This is also very important for me because myself, I come from a ethnic minority, and often ethnic minorities don't have an opportunity to speak about. I believe that it was very important to understand what the communities knew about pelvic health problems in general, because pelvic health issues are often very hidden, and people not always know what they are supposed to do in terms of help and support for pelvic health. So for me, it was very important before we developed the service to start engaging with people in our communities to understand what their needs were before we even developed the service. When we were planning our engagement, we started looking, first of all, at our population across maternity services and our communities for all of our 6 boroughs. We also look at the different languages that were spoken to across the system. So we had a look at our joint strategic needs analysis from each of our boroughs. And once we look at this information, we started looking to see what the more common languages were spoken across the different boroughs. But also, when we were looking at this information, we also had data for women who have suffered, for example, very difficult tears at birth by their ethnicity, and which women were more at risk. For example, women from Southeast Asian and Asian backgrounds were more likely to develop tears. So we were very keen to engage with this community. So we decided that we were going to engage with particular communities and particular boroughs because of the population, but also because of the risk factors of that population in relation to pelvic health. But in general, we wanted to engage with women and birthing people that we don't always hear of. So we also had planned to engage with women from the Gypsy, traveling and Roma community. And also we wanted to engage with the Latin American community also because it's a quite large population in Sadek and Lambeth.